Bonjour, Gisha Wanwa Indigenous cause, Amshadong and Donjaba, Michigan and Dodam.
Bonjour, Zanagmasin Kwan Adishna Kaz, Mikazi Dodam, Anishinaabe meanwhile and Epi Kwandao, Mimam Pi Gegwa, Nedunjaba, Beketranan.
Bonjour, Pinawa, Hepmat, Jik Shaw and Ebenes and Digo, Bijio and Dodam. We're quite dong and Donjaba, Kettle and Stony Point First Nation, Shaganashi, Moen, the Zinka, the Shkunagan.
I think throughout history, our people have had a really difficult time in some of these mainstream organizations and places. And a lot of that is it's a representation, it's a symbol, of that history.
We've learned to cover up what's really going on inside because we do have that distrust.
Many people are still afraid to come to the hospital, and for various reasons. We see that there's still anti-Indigenous racism in some areas across Canada, and we just don't want that to happen at Bluewater Health.
It's important to have the Indigenous navigation team here because we can come alongside the patients when they come in and meet them where they're at and give them the support that they need.
When you're in that vulnerable position, you want to know you've got the supports, that somebody's going to be speaking for you and fighting for you for the best possible care that we're entitled to. And I think that's still, what we're really mindful of is our people getting the quality care that is their right.
We're a part of their healthcare team to be able to enhance communication, I think, in order for them to get good service. It could be anything, setting up interpretation services. We would also help them understand their healthcare plan. Sometimes they're not so comfortable communicating with their healthcare providers. On the sideline, they may tell us something that's very important for them.
Sometimes I will come to a room and I will sit down and we'll chit chat, and then I'll get into, how are you feeling? Where is your pain level at? And then they will open up to me.
We also provide what I call, kind of value checks to make sure that they have somebody to visit, somebody to talk to. We would also prepare for them when they're ready to be discharged out of the hospital to make sure that they have adequate services in place, when they're ready to go home.
Knowing somebody is there if they need that service from the navigators or if they need someone to go and speak on their behalf. They said, we have a safe place to come to smudge, to talk. Whether we're here in the hospital, whether we're at Ryan's house, or whether we go out into community, the feedback has been very positive.
The navigation team, Ashley, Doy, and Doug, are essential part of the hospital. You feel connected with the native part because we can go and they can do a smudge in the spiritual room. We can go in there and sing a song, everything that they do. I'm really proud of that team.
When they have support within the system, the quality of care improves. And the better the quality of care, the better the quality of life.
I have that passion to want to come alongside people and meet them in that vulnerable spot and say, you're good, you're here and you're healing and you're going to get well and, I support you.
I love being able to come, just drive down the road and be able to support the community members and the communities that are near and dear to me.
We have very large families and extended families, and we want to help them create a better experience, I think, with their healthcare. Well, and they remember that the next time they come in the hospital. So they'll remember, okay, I was taken care of in a good way by the staff at Bluewater Health. And so I'm going to go back there.